Good morning. This is Dr. Ms. Ramesh Sarin, the senior most surgical oncologist doing breast cancer surgery at the Apollo Hospital, New Delhi, India. I'm going to talk to you something about robotic breast surgery. Robotic breast surgery has come in a long way as we improve the patient satisfaction, the patient's quality of life, the patient's emotional well-being, and the cost basis. There are two objectives to breast cancer surgery. One is to get the tumor out completely with so-called negative margins, and secondly, the complications associated with various techniques, and thirdly, and most importantly, which has not been given due respect, has been the patient's psychological, cosmetically, and sexual and other well-beings. And hence, there have been lots of improvements in the surgical techniques of breast cancer surgery. And robotic is the latest kid on the block. The kid at present is in an immature stage, but as infertility, you have immature babies. With due care and with due clinical and scientific evolution, we are bringing more mature kids on the block. So hopefully in due course of time, it's going to mature and it's going to possibly replace the conventional open surgery in few selected patients. There are obviously training in robotic surgery, but the robotic surgery is not difficult to get trained in if you already are a good breast cancer surgeon. If you already know the planes and principles of open breast cancer surgery and the breast reduction surgery and breast conservative surgery and the replacement, it is not difficult to get it done rightly. The robotic surgery do have indications because it should be done in early cases as you're going to save the skin and the chest wall. And so the tumor should not be close to the skin or close to the nipple, areola, or involving the retroareolar tissues. It should also be done in patients who require or who demand or who want breast reconstruction surgery at the same time as the skin is going to be saved, and hence there has to be an implant or something underneath the skin to make it a round shape. Again, it should be done in patients who are mostly genetically predisposed to higher risk of breast cancer, like BRCA positive or other genetic disorders, where you could do bilateral mastectomy. One is a risk-reducing mastectomy where there is no cancer, but you are doing a mastectomy as a prophylactic, and hence patients should have as near a breast as possible. So bilateral mastectomy with reconstruction at the same time is an extremely good indication for robotic breast surgery. Robotic breast surgery, as we said, reduces the complication rates of large incisions, infections, reoperations, in fact even seroma. And though it takes little longer time, but then the final outcome is better than open surgery. The time consumed for surgery should not be an option for good surgery. A good surgeon may not be a quick surgeon, but a good surgeon can be a slow surgeon but does the job properly. So also robotic surgery, though it takes longer time, but the outcome at the end of the surgery and a long period are better. The only hitch about robotic surgery is that we still don't know the oncological outcome of long-term follow-ups whether with regard to local recurrence or distance recurrence. We do have small group of patients where follow-up for 5 years has been done, but it numbers 50 to 100. We need larger number of prospective trials where half the patients suitable for robotic surgery undergo open surgery and half the patient undergo robotic surgery, and have their follow-ups over a period of 5 to 10 years in a large number of patients to say that robotic surgery outcomes are better or at least at par with the open surgery, with lesser complications, with lesser mental trauma, with lesser emotional trauma, lesser sexual trauma. So robotic surgery has come a long way. It's been there for the last 20 years, but its importance as with regard to other organs like the gynecological and uro-oncological robotic surgery has also found a place in breast cancer surgery and breast cancer reconstruction at the same time. Apollo Group of Hospitals is a great corporate group of hospitals, has several extremely talented people, educated and trained in the best centers in the world, and with great leadership and great long-term outlook for the health of the people of the country and to reduce the cancer burden, to prevent cancer and to win over cancers, and to have the best medical, surgical and radiology approach, and a coordinated and a multidisciplinary approach is the main objective of Apollo Group of Hospitals. So it's a great place to work. It's a great discussion group, and once in 2 years, Apollo Cancer Conclave bridges all the gaps of the latest techniques being done abroad and latest techniques and latest advancement in breast cancer or in all cancers is discussed on this platform. Thank you.